education and background, and exactly what brought you into this line of work?
It's a funny thing. I started off as an internist and an intensivist running intensive care units, so that's why I'm so adept at putting needles in people and lines, because I was the one to put in the central lines and intubate people and tracheotomy tubes and things like that. And I had a flourishing medical practice, and a friend of mine who was a plastic surgeon said he wanted me to come with him to a meeting up in Boston where they were discussing new treatments for varicose veins. It was called sclerotherapy, and I never heard of the term before. So going up with him, we went to this meeting given at Massachusetts General Hospital by the North American Society of Phlebology, which was a vein society. There were 70 members at that time. Now it's called the American Society of Phlebology, and there's 1,700 members. And they were talking about how to address venous insufficiency in varicose veins. And at that time, while I was listening to them and going through their protocol for examining people with swollen legs, realized that not everybody with a swollen leg was suffering from right heart failure, that it was really this problem of venous insufficiency. And they had marketing people there selling some instruments to do these examinations. So I bought some and started examining my patients in my office and found out that 40% of the people that I was treating and that cardiologists were treating, that I was also treating for swollen legs, because we thought they had right heart failure, really had a problem with valves in their legs. And nobody was realizing this because they didn't have obvious varicose veins.
Interesting.
So now I was making diagnoses. And then I trained. It took 2 years of training through the society. I was going back and forth to Europe studying under the best guys in the world that were doing these treatments. I started treating my own patients. And I was getting them off all these cardiac medications that they didn't need because their problem wasn't a heart problem. They didn't need digoxin and Lasix because the heart was fine, even though the limbs were swollen. And I was able to reduce the size of the limbs by injecting away broken check valves in the vein tracts in their legs. So they felt better. They weren't taking these medications that can have a downside effect, and their legs became slimmer again. And they didn't go through the process that people do go through with swollen legs, which is a chronic swollen leg can cause stasis dermatitis and discoloration of the legs, swollen ankles, browning around the ankles, hardness of the skin. That all dissipated once their varicose veins were treated.
Dr. Fretta, is there anything specifically that you want people to know about your practice or about you in general?
Well, our goal, my personal goal, is to give people the best care I can. And I have knowledge in procedures that orthodox medicine really doesn't have. The study of phlebology, venous disorders, is really a European study. We really didn't learn that in our residency programs in the United States. Now we have the American College of Phlebology, which has trained 1,700 doctors in this country to practice the treatment of varicose veins the right way. And I've been fortunate enough that I've been with them since 1987. So I've learned a lot along the way. And we try to keep things affordable for people, give them the best results possible as soon as possible. And when you make someone's legs appear better and feel better, I have so many people who change lifestyle, because, especially among the women, because now they can wear a skirt again.
Sure.
That's something you can't really hide, you know. And in many ways, a woman's legs are her sexuality. So you make their legs look more presentable, they start exercising again, they stop doing self-destructive things like smoking and whatnot, they eat healthier, and they're happier. So, you know, that's great. And that's how the cosmetic end of it came into play when I affiliated with my associate, who was a plastic surgeon, and we melded both practices because one fell into the other. You know, now that you made my legs look better, what can you do about my hips and this and that, you know? So we put medicine, getting them healthy physically, taking care of their vascular problems, and taking care of their cosmetics. And it's all under one roof.
So they look better, they feel better, and they have an overall better quality of life.
Because they take care of themselves and they're happy.
Well, you've certainly provided our viewers with a wealth of information, and I know that I personally have come away from this experience much better informed. So I thank you so much for your time, and I really appreciate you inviting us into your office.
It's been a pleasure.
Thank you so much.
Thank you.